Go segment is made possible by Spectrum Health Medical Group.
As women, it's common for us to focus on our health during our childbearing years, but did you know that what women experience during pregnancy can actually be an indicator for later health concerns? Dr. Vivian Romero is here to discuss pregnancy and future health. So I'm so happy to have you here, Dr. Romero. And I know that you have said there are 3 key times that women really focus on our health. What is that?
Well, first of all, thank you for having me here today.
Thank you so much.
Yes, this is true. It's interesting that we are the healthcare takers of our family. We make most of the decisions around our household. But if you think about it, and we're the ones actually choosing who is going to be taking care of, our family, who is going to be our healthcare provider. But if you look, it's interesting to see that women only take care or receive regular care during childhood, early on, also during pregnancy and postpartum, or if they develop some sort of chronic condition like having high blood pressure or diabetes. So it's interesting that it's only those 3 times in life where they receive care.
Right, early childhood, during pregnancy, childbearing years, and then when they can't avoid something. It's something bad that they have to get taken care of.
Exactly.
So chat with me about pregnancy then, because I know that there are a lot of risk factors that can lead to more risk factors later on in life.
Exactly. So in what we see the pregnancy as a window of opportunity to identify risk factors and actually make improvements on the health of a woman. What I do for a living as a maternal fetal medicine is taking care of patients that have some complications during pregnancy, whether they have placental syndromes. And what is that? People usually ask, what is that?
Right.
What are you talking about? So common complications in pregnancy can be the high blood pressure in the form of preeclampsia or gestational hypertension. A lot of people doesn't know what preeclampsia is because, if you didn't experience, what would you know about it?
Right.
The other common complication that we see in pregnancy is gestational diabetes. And having a baby that is not growing well in the womb, we call that fetal growth restriction, or having the placental abruption, which is actually when the placenta separates early, or a preterm delivery. So if you have any of those common conditions, those could be just markers or early markers that you may develop heart disease later in life. Actually, the American Heart Association identified those complications in pregnancy as risk factors like any other risk factors that we know, type 2 diabetes, hypertension, for developing chronic disease, heart disease later in life. And one of the things that I want to convey today is like, why is this important? So heart disease is actually the leading cause of maternal death, and it's a preventable disease. So that's why it's so important, because it's a preventable disease. So it takes years, it takes decades to be able to develop heart disease. So there are interventions that we can provide during pregnancy or soon after delivery.
Wonderful. Thank you so much for coming in today and sharing your wealth of knowledge. This is a really powerful subject, and if you want to advocate for your own health, give Spectrum Health a visit. We've got all of that info online at 13onyourside.com.